Is it possible for a doctor to predict when someone with heart disease is going to have a heart attack? Well, researchers at the Intermountain Medical Center Heart Institute say yes. Dr. John Carlquist joins us now to tell us more about this landmark finding. This is pretty exciting. So talk to me about when you first started this study. What was your original intent?
Well, we embarked on this study primarily to see if we could identify any kind of a marker which would predict or give us a clue as to what's happening in an individual just prior to a heart attack.
And so we've heard a lot about having someone taking like a Tylenol before then, but you're trying to pinpoint even before that. What's going on in someone's body? What did you find?
Exactly. Well, you know, a lot of people develop coronary disease, develop plaque in their arteries. Some of them go on to have a heart attack, some never do. So we were trying to just identify why some people are stable and live their entire life without ever having a heart attack, despite the fact they have coronary artery disease, whereas other people eventually have one, maybe two heart attacks.
Okay, so if you, how did you figure out that you could possibly predict that?
Well, we started almost 20 years ago.
Wow, yeah.
Collecting samples from individuals who came to the hospital with heart disease, and we've been able to follow their course clinically, what their outcome was, and we can look at the markers in those blood samples. And it just turns out that out of the 30,000 samples we collected over those 20 years, we just by chance collected a sample within a few days of someone having a heart attack. So this is very rare. I mean, this is not an opportunity that many people fall upon. But we had these samples several days before a person went on to have a heart attack, and we then examined those samples to see if there were any kind of identifying markers or biomarkers, if you will, in there that could predict or at least tell us what kind of process is going on in those individuals just prior to that heart attack.
We often think about heart attacks. We associate that with men. We know that it's the #1 killer for women. So this is affecting a lot of people. If my mother or grandmother has heart disease, how can what you found help them?
Well, clearly that's one of the major risk factors. If a first-degree or even second-degree relative has had heart problems, then the chances of you having similar heart problems is much increased. So what we're hoping, or what we were hoping with this study, is not so much to find a test to predict who's going to have a heart attack, but just kind of gain a window on what the process is leading up to that heart attack. And when we have a further understanding of what that process is, then we can maybe develop interventions to turn that process sideways or something of that sort.
Now my wheels are churning. We're talking about heart disease, but I'm thinking about other diseases, other conditions that people are plagued with. Can this study be used to, let's say, look at cancer or something else that is an epidemic in our country?
Absolutely. As a matter of fact, the markers we found, they're called microRNAs, and they've only been looked at recently in heart disease. Originally they were studied in relationship to cancer. That's where they actually began, that's where the research began, and we've sort of adopted what those people were doing over those years to follow heart disease as well. And it's being studied, they're being studied in many other diseases. They were only discovered back really in the late 70s and pretty much remained unknown for a number of years, and it's only been in the last 10 or 15 years that people have really found they have a really significant role in human health.
Well, we appreciate the work that you're doing, Dr. Carlquist. From a doctor, give people out there who are watching right now advice on how to take care of their hearts.
Well, I think eating well and exercise are clearly, not smoking. Those are clearly the big ones if you want to maintain good heart health.
Things we know but may not be doing that we should be doing.
Clearly.
Dr. Carlquist, thanks for joining us.
Thank you very much.
Don, back to you.